So I have something written here that I'm going to read. Because of our healthcare provider shortage, that's the reason behind the introduction of this bill. And the purpose of this bill would be to bring back the medical licensure compact use, whereby patients would be able to obtain telemedicine services again. As you all know, during COVID, these services were needed and utilized greatly, and that provision has sort of sunsetted. This bill would reinforce that provision to expand telemedicine access to everyone. Some of the reasons I think this are especially important is not only the incredible provider shortage that we have in the state of Rhode Island, which, as you all know, no one can find a doctor, see a doctor. Wait times, I believe, with Brown Medicine were reported to be now up to 2 years with the closing of Anchor. So we need solutions, and we need them now, and there's many proposed. I think this bill is a good solution to help close the gap. Not only would it allow access to providers sooner than the wait lists do, it also answers to the question of the elderly. The AARP wrote in support of this bill. As a nurse, I can tell you many times, elderly cannot make it to their appointments, and that may be that they don't drive, or they can't navigate the public transportation systems, or the weather's in the way, or they simply don't feel well, and they miss a lot of appointments, and that does hurt their care. Telemedicine is an absolute gift to the elderly population, and I think something like 18% of Rhode Island now is elderly. So we're not only addressing the provider shortage, we're addressing services to our elders, and I think that's extremely important. So this bill would create a permanency in which telemedicine is accessible. It also has a provision whereby the out-of-state providers have to register with the Department of Health, because of course we want to make certain that the right people are coming through the door, right? And I think the Department of Health wrote in stating that the registry would be redundant, and if that is the case, I have no problem with changing the phrasing of the bill or removing the registry, because that would not reduce its objectives and its benefits. The other point that they brought in to their testimony, or maybe we'll speak on in a moment, is that many boards already allow telemedicine, and I'm sorry, that's simply not enough for me. Many boards is not enough. I want access to telemedicine for Rhode Islanders, and this bill would obtain that.